toxoplasmosis?
Toxoplasmosis is an infection caused by a single-celled parasite, called Toxoplasma gondii. The parasite can be found inside the cells of humans and animals, especially cats and farm animals. The parasite can exist for a long time in the human bodies, even for a lifetime. Toxoplasmosis infects 25% to 50% of people in the world. The infection rate in China is 5% to 20%.
How do people get toxoplasmosis?
Toxoplasma gondii cannot be absorbed through intact skin. People can get infected during birth through mother-to-child transmission. Besides, they can get toxoplasmosis by accidentally swallowing the parasite through contact with cat feces, or by eating undercooked contaminated meat, or shellfish, and not washing hands thoroughly, or using contaminated knives, utensils, cutting boards, after handling the infected food. They can also be infected by drinking water contaminated with the parasite.
Life cycle of Toxoplasma gondii.
Let's look at the disease in the definitive host. Cat. Infection comes about by eating an infected intermediate host. Toxoplasma gondii multiplies in the cat, and the infectious material, called oocyst, is shed with the feces. At the same time, the toxoplasma will spread over the body of the cat. The immune system of the cat will start to work, and the parasite will form cysts around it and hide inside the host. The cat is now healed and will not shed oocysts in its feces anymore. Meanwhile, an oocyst needs about 1 to 4 days in the open to become infectious. If the intermediate host, which can be a mouse, a cow, a pig, or even the definitive cat, takes it, it will become infected. Humans can be infected by taking in oocysts while doing gardening, or by eating unwashed food or uncooked meat, contaminated by toxoplasmotic cysts. Similar to the cat, the toxoplasma will scatter throughout the body. However, no infectious oocysts will be shed.
Can my cat easily spread the infection to me?
Cats rarely have symptoms when infected, so most people do not know if their cat has been infected. The cat will become a definitive host only if the cat eats a raw intermediate host, but the chance of this is quite slim for a domestic cat. The cat may also lick up oocysts in its surrounding. However, because the cat is quite resistant against the toxoplasma oocysts, the quantity must be large. The cat is a potential risk if it has not contacted toxoplasma before, because it may become infected at any time and start shedding oocysts. After infected by the parasite, the cat will spread toxoplasma in their feces for about 2 weeks. That is, a cat is risky for about 2 weeks in its entire life. Besides, an oocyst needs about 1 to 4 days in the open to become infectious. So, if we empty the cat's litter box frequently, it is not easy to get the infection from the cat.
Signs and symptoms of toxoplasmosis.
Most infected people have no symptoms, because healthy immune system usually keeps the parasite from causing illness. Some may feel as if they have influenza, with swollen lymph glands, or muscle pains that last for over a month. The parasite can flow to all parts of the body via the bloodstream. It can damage the brain, the heart, and the eyes, leading to various other diseases. Most infected infants have no symptoms at birth, but they may develop symptoms later in life. A small percentage of infected newborns have serious eye or brain damage.
Who is at risk for developing severe toxoplasmosis?
Infants born to mothers who are newly infected with Toxoplasma gondii during or just before pregnancy have high risk. Also, elderly and pregnant women are at risk. Persons with severely weakened immune systems, such as those with AIDS, those taking chemotherapy, and those who have lately received an organ transplant, may also develop severe toxoplasmosis.
Diagnosis of toxoplasmosis.
Antibody serology is an effective way of identifying infection. In adults, Toxoplasma IgM, IgE, IgA, become detectable within 7 to 15 days following infection. However, toxoplasma, IgG is usually detected after 15 days following infection. Therefore, if the result is positive, it can indicate whether the infection has occurred recently or not. Polymerase chain reaction testing of amniotic fluid has also been used in rapidly identifying fetal infection.
Diagnosis result.
If the test is positive, and the person has contacted toxoplasma before, there is no risk at all. There is no danger, if the test on the cat is positive, as it does not spread the disease anymore, unless it just happens that the cat is in its 2 weeks infectious period. If both the person and the cat are tested negative, there is a chance of getting infection later. However, there are other sources which are more hazardous than the cat.
Treatment for toxoplasmosis.
Any medication is only useful for acute toxoplasmosis, during the dispersion stage of the parasite. Common drugs prescribed are pyrimethamine, plus sulfadiazine, or trisulfur pyrimidines. Pregnant women may also use spiramycin to prevent transmission to the fetus. For a healthy person who is not pregnant, there is usually no need for treatment, since their immune system can work against it. If symptoms occur, they usually disappear within weeks to months. For the cat, medication is usually not needed, as the cysts will resist the chemical medication. However, the treatment may stop the cat from excreting oocysts, therefore, reducing the chance of infecting others. For people with weak immune system, drugs can be used to treat toxoplasmosis. For a pregnant woman, if the infection happens during pregnancy, she is vulnerable, and the toxoplasma spreading in the body may go to the fetus, causing serious damage. The younger the fetus, the worse it can be. In this case, drugs can be used. If she has had the infection before, there is no need to worry.
Prevention of toxoplasmosis.
Cook the food thoroughly. Do not eat raw meat or undercooked oysters, mussels, or clams. Wash vegetables thoroughly, and peel fruits before eating. Wash hands, cutting boards, dishes, utensils, with soapy water, after contact with raw meat and seafood. Wear gloves when gardening, and wash hands afterwards. Because toxoplasma oocysts become infectious in 1 to 4 days after they are shed in the feces of a cat, we should clean the cat litter box daily. Last but not least, teach children the importance of washing hands to prevent infection.
Conclusion.
Toxoplasmosis is caused by a parasite called Toxoplasma gondii. The cat is the definitive host, but it only sheds oocysts for about 2 weeks in its lifetime. It is easier to get infected from sources other than the cat, such as eating raw meat, and contacting contaminated oocysts. Most infected people have no symptoms. Only newly infected pregnant women, and those with severely weakened immune systems, may need medication. Cleaning the cat's bin frequently, avoiding eating raw food, and washing hands thoroughly, are the best ways for prevention.